Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, as part of our election series, Stephanie Desmond talks to Tom Burke, a Johns Hopkins Bloomberg School of Public Health professor and the Environmental Protection Agency's science advisor during the Obama administration. They discuss what's at stake in the upcoming elections when it comes to the environment. Let's listen.
Tom Burke, thanks so much for joining me.
Oh, thanks for having me.
So today I'd like to talk about what's at stake with the environment in this upcoming election.
I'm so glad to be here today and that you asked me that because there is so much at stake with the environment. This is a really critical election. The public, the voters have a clear choice, very different perspectives. One being aimed toward ending regulation and relaxing the burden on industry. And in the name of that, unfortunately, we've had a tremendous reversal of our environmental gains in this country, whether it was the quality of our drinking water or climate. And so there are clear choices here, very big differences, and it's important. I think the American public really cares about the environment and our health, and the environment is essential to good health.
So, but the backbone of all of these environmental discussions really is science. And I know that the reputation of science has taken a hit. Can you talk to me a little bit about that?
Well, I sure can. And you know, as maybe the last EPA science advisor, I was intimately involved in the importance of science and the evidence base to guide our national decisions about the environment, whether it's our energy choices or our air quality. It is so important that we have scientific integrity, that we have independence and transparency, the basis for our decisions. And this election also gives us a clear choice on science, as we see from the candidates. Very, very different perspectives. Now, most obvious over COVID and masks and therapies and evidence there. But when you look toward the very important issues of climate change and wildfires and the quality of our environment, it is so important that we use the best available science, that for public health, our decisions are based upon evidence. And part of this will mean reestablishing the credibility of science, because right now, very serious questions have been raised about science being a hoax or the disregard for science. This is really important in this election.
Climate change, obviously, is something that's been on a lot of people's minds. Before COVID, it was really the existential threat, and it's still back there, of course, in the background. So talk to me about the differences you see as the election comes forward on climate change.
Well, the most obvious thing is, I think, as we see with the current administration, one of the hallmarks of that administration was turning away from virtually the entire world and departing from the Paris Agreement and saying, that's not important. What's more important is energy dominance. And so climate change is clearly not a priority to the current administration, and we have choices to make there, whether it be our energy sources and investing in renewable energy, or whether it be taking seriously the threats that are so real. It doesn't have to be the enormous wildfires of the West, which are so obvious, or the hurricanes of the Gulf Coast. Climate change is affecting us all. Even the streets of Baltimore are impacted by those incredibly hot days in the summer that are so unusual and have increasing frequency.
You brought up the fires. I wanted to talk to you a little bit about that. I mean, obviously, there are environmental issues there. If you could sort of talk a little bit about maybe why we're seeing what we're seeing.
Well, you know, it's interesting. It's not about forest management. Our climate is changing. We have increasing droughts. We have increasing dryness of our natural resources. We have changes in our forests. There is a higher risk of fires because of the changing climate. the long stretches without rainfall, the drought, the hotter days, the consistently increasing temperatures, they bring about a higher risk of fire. And so this was predicted. And clearly, we're seeing much worse than we ever saw the entire West Coast. And it's not just the loss of communities, it's the long-term impacts on all of us because those fine particles, the air pollution created by these fires, has devastating effects, particularly on our most vulnerable.
So the air pollution, talk to me about, we've seen some rollbacks of air pollution regulations. Is that right?
We've seen some scary trends, and it started with the rollbacks related to President Obama's Clean Power Plan. And that was part of the overall strategy to reduce our greenhouse gas emissions, but also had tremendous impacts on emissions from coal burning power plants that had tremendous health benefits. We also see threats to our ozone standard and our particular standard. The greatest gains that we've made in environmental protection since the dog days of the 60s and the massive air inversions have been in air quality and the reduction of death and illness and exacerbation of childhood asthma has been enormous. And now we face the rollbacks of everything from the ozone standard to the particulate material standard. And not only that, we have folks in scientific leadership in the agency that are undercutting the scientific base, eliminating the studies from the evidence base that's so important to making public health protection decisions.
We've seen at your old agency, we've seen there's at the EPA, there's been requests by the current administration to remove certain words from documents and to act like these aren't there. And I'm curious what kind of impact that has. If you could explain a little bit about that and what the impact has been.
Well, I served as an EPA official, but I have worked with EPA my entire life as a state official. You're so dependent upon a strong EPA. All of us need a strong EPA, not just in times of emergency, but to assure that when you turn on the tap, we continue to have safe drinking water, that when you breathe, we continue to be protected from harmful pollutants. And you're right, climate research was removed. Those programs, there are certain words that unfortunately are no-nos because of the denial of science. And it's clear that we should be global leaders in science. We should be global leaders as we once were in protecting the earth from the changing climate. And unfortunately, that vocabulary has been eliminated. And in many things, and it's not just climate, it's toxic substances, it's the implementation of our regulations, whether it's enforcement or the implementation of controls on pesticides, the science has been reversed and ignored.
Are the scientists still in these agencies or have they given up?
Oh, that's a great question. The scientists are still there. They're still there, and they are such devoted public servants. It's unfortunately the political leadership, the current political leadership has stifled the evidence base from driving their decisions. And they move ahead proudly with deregulation, with orders from the White House, from our current leadership, to deregulate under the false impression that there are not tremendous costs. So maybe you reduce the cost of environmental regulation on an industry, but then you impose those costs in spades to the surrounding community that has to bear the burden of the pollution.
Who bears the greatest burden of pollution? Who's at the greatest risk here?
Another great question. Environmental justice is the science of the recognition that pollution is discriminatory, that we have, unfortunately, the folks, our communities that are least able to protect themselves from environmental harms, the fence line communities, the communities of color are at much greater risk from pollution because they are living in the substandard housing. They are drinking the waters of, take Flint, Michigan, a poor community. But in Baltimore, we have issues of environmental justice in our formerly industrialized areas, our currently most industrialized areas, those who are near the heavy traffic roads. So environmental science is not fair, and the burden has been on our communities of color, and we have to change that. If there's been one lesson from COVID, it's that environment is more than just a single pollutant and worrying about one compound. It's seeing the health of the community and protecting the overall health of the community and understanding the environment plays an important role in that.
Has COVID exacerbated some of these issues?
Well, yes, COVID is a respiratory disease. And clearly, the evidence is emerging that those most vulnerable are those with pre-existing respiratory diseases. We know that the quality of the air, both the outdoor air and the indoor air, is very important in the respiratory health of our communities. And so the kids with asthma in the Bronx, in those heavily trafficked areas, the communities throughout the United States who are on the fence line of heavily polluting industries, they are not only at greater risk of COVID, but they're at risk of, unfortunately, a poor outcome once there is infection. So air quality goes hand in hand with our other prevention strategies. That's why these masks to filter air from virus particles and aerosols are so important.
So there's plenty, I guess, for voters to think about when it comes to the environment.
If you care about the environment, first of all, vote, but think about the trade-offs that we're making now and think about the long-term implications of this continued ignoring of the science. And hopefully we at the School of Public Health and our initiatives here can continue to push toward increasing that evidence base so we can make sound decisions. It's not an either or. It's a combination of how do we integrate thinking about the environment into thinking about our health. And that's what public health is all about.
Tom Burke, thanks so much for joining me.
Thanks for having me. Take care.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.